Trigger warning. This video contains references to themes of suicide and depression, which some individuals may find distressing. Dr. Vanisi Prescott is a GP and urgent care specialist. She migrated from Tonga with her mother at the age of 1. She is a mother of 3 and is passionate about helping youth and Pacific people. In her everyday practice as a medical doctor, she assesses and manages a lot of patients with mental health challenges. Nisi, thank you so much for saying yes to coming on the podcast. I start with that with every guest because, I don't know, there's reasons to say no in life. And we have a lot of requests from, you're online, the requests come in thick and fast, but you said yes. So just firstly, thank you.
You're welcome. Thank you for having me.
Awesome. Can we just begin by acknowledging the people who help you be here today? Who do we need to acknowledge in your family story that have given you the courage to pursue your dreams?
I would say my family, first and foremost, especially my mother. She is basically she's the rock in our family. And if I didn't have her, and she's a single parent, we migrated to New Zealand when I was only 1, and she's always been there. So if ever I have anything on, so I'm all over social media and I do all these things, and it's because of her. And she's the one who's always willing to help. And she works full time as well. So she works in the weekends. But yeah, she always cares for my kids. So I've got 3 kids as well. My husband, he is amazing support and he allows me to do all these things. In fact, he is the one that encourages me to do all these things. And it's just beautiful to have that kind of support. And my kids always support me throughout this whole thing, and the rest of my family. And I would say without them, I definitely wouldn't be where I am today. And also my faith in God and our religion.
I was reading a little bit in the notes here about just the impact your mum had on you.
Yeah.
What was it like for her when you kind of got capped or you became a doctor? Was that a proud moment for her? Because I read that you'd go with her to work when you were young.
Absolutely. And all the memories growing up with her is of me watching her go to work. She had about 3 jobs at the time. She worked as a cleaner, she was a caregiver, and during the day she was doing she worked in a factory as well. And so all these jobs that she had, I kind of would tag along with her, mainly the cleaning at night. And I just remember these times where I'd be lying there and she'll just cover me while she's cleaning. And occasionally, sometimes I would be helping her to clean. And this is me at around age 4 or 5, just tagging along with her and just seeing her struggle and all the things that she had to go through really had a huge impact on my life, and actually made me want to be something, to be someone where I didn't have to do what she was doing and have to struggle so much. What's beautiful about her is that she didn't even show that either. So, she would still try and provide for me, spend time with me, and just showed me a lot of love and care. And I just fully respect her for that, because that's kind of made me the mother that I am today with my own children. And when she found out that I got into med school, it was a big deal. Well, one thing she did say to me was if anything, because she's a single parent, she was do not rely on anyone, try and get a job where you can look after yourself, because unfortunately she didn't have a job after she did rely on my father at the time, and she didn't have a job. So she kind of had to build up her own life and her career and know what it's like to be out there and start working. So it was something that kind of stuck with me, and I was like, okay. And she said, yeah, and be a doctor. I was like, okay. So that's when I just tried my hardest to get in there, and it wasn't an easy journey. It was tough, because I wouldn't say I was the smartest cookie back then, but it was worth it, and I just know that she loved that, and when I did become a doctor, she was just over the moon. I couldn't believe that I did it.
It's nice to acknowledge that.
Yeah, absolutely.
We talk about suicide prevention. Those of us who are lucky to have a rock, it's hard to look past.
Absolutely.
Yeah, so it's choice to shout out to Mum there. I guess from a medical standpoint, if someone says to you mental health, what does that mean to you? What does that mean to you as a person and to you as a doctor?
there's a number of definitions for mental health itself, and it could mean different for different people, even for different cultures. But when people, often what I hear, like when people come in and they say, oh, I'm suffering from mental health, often they're referring to, I'm feeling low or depressed. Like usually that's what they mean, or I'm just feeling so overwhelmed. And most of the time that kind of is that, like that is pretty much the definition, is like not just feeling blue and down and under, but it's the whole aspect of just, like just basically not being able to cope, feeling anxious, feeling overwhelmed, stressed, like all these terms kind of coming into play. And also for some people, just that feeling of giving up. Like, I've just had it. I've just had enough.
And for our Pasifika community, you can think of things like there's lots to do in the community, helping others before you help yourself, financial stresses, language barriers. These are not just things, they contribute. Well, I'm asking, I guess, do you think these things do contribute to like a negative mental health? You know, it's not just that we had a tough day. It's like as people, we can only take so much, right?
Absolutely. And I think that's the like good and bad thing about us Pasifika people is that like we do have so many different roles other than just our one role of going to work and just say, for example, like me being a doctor, like I've also got a role of being a mother, and then we've got church commitments, we've got family commitments to care for other family members within our household and even extended family. But it's all these sort of commitments and all these things that we have to do that kind of can have an effect on our overall mental health. And that comes back to the whole sense of being overwhelmed. Like a lot of people talk about us Pasifika people, gosh, you guys have so many things going on. Like you've got this, and we're prioritizing all these things. But really, people don't really understand what it is that we actually go through, what it is that we need to do. And the biggest thing that we need to do, and for us as Pasifika, is provide. And we provide for our family, we provide for our community, we provide for everyone. And having those expectations of us having to provide all of this can be a lot, especially for one person to take on. And unless you actually seek help for yourself, all of this just becomes a bit much and just builds up over time.
That might go to explaining some of the negative statistics too, as it pertains to suicide and poor mental health. I mean, when I look at the statistics, it seems overwhelmingly that we are at the higher end. And I think I just want to be able to have that conversation around like, you're trying hard, we're trying to make everyone else happy, but at a cost to ourselves.
And that's right. We're always putting everyone else first before ourselves. And that's very common. And that's often what we hear from a lot of our patients as well. But you're right. Yeah, it's having that negative impact on you. It's having that negative impact on your mental health, but not just your mental health, like your physical health. Like we've got high numbers of non-communicable diseases among our people, diabetes, obesity. And again, like because our people are not putting their health first, like they're not putting their mental health first because obviously they've got to care for their family. They've got to do all these other commitments. They've got to work full time. They've got to work after hours, even evening shifts. And so they're not able to keep these things up, like sleeping and eating well. And all of this just has a negative effect on, physical and mental health.
And as it might sound like a silly thing to say, but can having not a really good diet or not sleeping as well, or I guess having a higher blood pressure, can that contribute to negative mental health? Because I think most people would agree I think we all think that contributes negatively to our physical health, but that it might not be part of our mental health, but it really should be, right?
Yeah, absolutely. And I mean, we talk about this to our patients who do suffer from mental illness, is that lifestyle changes is very important, just as important as it is for your physical health, your mental health. I mean, sleep, absolutely. Like if you don't get enough sleep, you can't concentrate, you can't think, you end up being a lot more grumpy, you get angry. So sleep is really important, and same as exercise. I mean, physical activity is great. It actually even helps to boost your mental health, And studies have actually proven that even just 1 hour a week can actually help to improve your overall mental health. And so these things are not only important for your physical health, but definitely for your mental health as well.
And I think what's cool is you as a GP saying that. For some reason, we need it to be validated. But for another reason, no one's out there saying it. And I love that you're citing things like, there's research. And it's really important to get that out there, because it's not just get together, go for a walk with someone. You're most likely going to do something for yourself physically. If you're walking with a friend, just as an example, if you're able-bodied, you can have a chat.
Yes.
And then all of a sudden you're kind of doing counseling with each other.
Yeah.
And it's not like these are real things, eh?
Yeah, exactly. And I think that's the beauty of it as well, because it's making those connections. And so if you are going to be walking with a friend, not only are you connecting with them and you're able to open up, and these things kind of come naturally anyways, because you have these normal sort of conversations, and it's not like it's actual counseling, but it's being able to just kind of talk and offload some of the things that you've kind of been going through, but also connecting with nature. Like that's actually quite beautiful as well, just to be outside and then smell the fresh air and enjoy nature. So that connectedness is quite important.
Yeah, just taking a moment to think about that, because there's not enough GPs out there to save everybody, right?
Yeah.
And we've got to do some of it in our communities. And so to know that maybe the role of getting together for the cuppa or the feed is cool, but if we add some extra things to it, it might just do a little bit of positive work there.
Absolutely, I agree.
How have you managed kind of your busy life? It's probably, and I guess if there's examples, maybe it was when you were studying and whatnot, where you felt that pressure of lots of things going on, lots of expectations on you.
Yeah, and I think that's a really good question, and I must admit I have actually I've had bouts of these moments where I've kind of felt low, where I've felt so overwhelmed. Like, what do I like? Should I be doing this? Like questioning the things that I'm doing as well. And on numerous occasions, throughout med school, I had a lot of that where I just felt like all these negative thoughts were going through my head, like, am I even worthy of this? Like, should I even do this? And because I was pregnant with my daughter during medical school as well, and that was the most difficult year, being pregnant and trying to sit my exams. And I was at that point where I just felt like, I don't know if I can keep going. You know what I mean? And then I managed to come through it. It's just amazing how I just seem to turn around and actually fight through those times. But I must say it's because I sought help quite early. And I knew, I could feel within myself when I started to kind of go off, and that would be I would just distance myself from family. I would close myself in the room. I would be constantly crying. And that's when I knew, okay, Vanisi, I know that you're not feeling good at the moment. You need to ask for help, talk to someone. And so that's what I do. I reach out to my family, my church friends, my church family, and pray. And then I start to find what is the things that I actually enjoy the most. And I think that's something really important for people to know is, what is your zen? What is your happy place? And for me, it's dancing and hanging out with friends and doing all of these things. And so I knew I had to touch those. I needed to grab onto those and try and do more of those things, just to make me know what it is that I want and what is my purpose as well, my sense of belonging. What is it that I need to do? And I always was reminding myself, I need to do this because of my mum. I need to do this because of my family. I need to do this for myself and our people, because at the end of the day, this is going to help everyone, not just myself. And so all these positive things kind of would come into play, and that's what would help me kind of get through.
When we talk about holistic, what does that mean?
Holistic is our body, our physical health, our mental health, spiritual health, as well as our mind, and then also your family and whānau that's around you. And that's really important, because all of those aspects is what makes our health, our total health and our well-being. And so in order to tap into these various things, whether that's our physical health or mental health, we need to tap into all those aspects.
Is it challenging as a GP to get that done in a very confined time limit?
So challenging.
Yeah, that's not going to make any of your colleagues mad. I just want to be able to say that there's a few constraints here.
Oh, absolutely. And there are a few constraints. And I think having just that 15 minutes is difficult, particularly for us GPs. I mean, within that 15 minutes, that's where we're building rapport. That's where we're, like, if we've never met this patient before and they come in and they're sitting there, they're facing the ground, and we're trying to understand exactly what's brought them in, and then they've finally sort of taken the courage to say that, look, I've come in for my mental health. It's already 15 minutes and it's over. I'm not going to say to this patient, I'm sorry, I've run out of time. You're going to have to get out. I can't do that. So these time constraints really do have an effect on us as a GP, and also the way that we can care for these patients. I guess in a sense it is kind of nice. We're starting to see we're like within GP, we've got a health coach. We've also got a health improvement practitioner. And so after we've kind of seen the patients, built that rapport, we can actually hand over nicely to some of these colleagues of ours within our practice. It's a shame because not all practices actually have this in place. But having that support, and when we talk about multidisciplinary care, if we are very constrained, like with our time, then at least having these other people and our colleagues that we can kind of rely on to help us to just engage with our patients and give them that extra support that they need.
And of course, everyone is different, but if you were generally speaking to young people watching and they're not sure about what they're feeling and if they need to talk to a friend or see a GP, can you just outline a possible experience they might have if they were going to come and visit you, for example, and what some potential, hopeful solutions might be for someone being brave to take that step? Because sometimes we hear it's about other people filling that space in a positive way to be a support mechanism. But if you're someone who doesn't have that support mechanism, doesn't have those rocks, but you still want to seek help, what might it be like if they come to visit you?
For youth in particular, I guess some of the barriers would be maybe they wouldn't want to burden their parents, so they wouldn't want to take their parents along with them to go see a GP. And I think the beauty of having GPs within the high schools is quite amazing. And so I used to be a GP in a high school, and that was great because confidentiality was amazing. Like we wouldn't have to kind of, reach out to parents or anything unless there was the risk of, if there was suicide and other things as well involved. But that was quite nice because it's access. Access is really important. And within that space as well, it's just you and the GP. And it's over time sort of getting, like just basically building relationships with these students. And I kind of liked when I worked in the high school, I would see one student would talk about things and then they were comfortable with me, and then they'll go back and tell their friends. And so then sharing that with their friends, they're like, oh, actually this doctor, like you can actually open up to them. So it's actually opening up ourselves as well as GPs and doctors and listening to them. All we need to do really for these kids is just be an ear. Like you just need to sit there and listen to their concerns, like listen and understand what it is that they're going through, because they don't get that in their households, most of them, and most of them don't have anyone to speak to other than their friends. And their friends, yeah, that's great, but it's about getting that right advice as well and what to kind of take on board and how to deal with these things. And most of them actually don't understand that they are going through these things. They don't know if it's depression. They don't know if they're feeling anxious. And so once they've had that experience with us as a GP, they go and tell their friends come, and then it normalizes things within their group of friends. And then they all tend to start opening up to each other, and they start speaking about these things openly, and they're not ashamed of it, which is so beautiful to see.
Is there something healing about, I'm not trying to get into the psychology too much, but when you open up to someone you trust, who has good advice for you, what do you think that does as opposed to the opposite, holding it and bottling it in?
Oh, it relieves that pressure that they feel within themselves. So whatever it is that they've been going through, like being able to just offload, like takes all this weight off your shoulder. And so that one little step that they've done to do that, that's kind of taken that little bit of a pressure off of them so that they're not feeling too overwhelmed.
Just looping around back to your mum, how do you think they dealt with mental health and struggles? And like there must have been, I can think about my mum and even my dad, there must have been a lot of bottling up. And it's amazing that they made it, right? And yeah, do you ever think about that?
Yeah, and I even asked her that. Like I said, did you ever face these sorts of feelings, Mum? And she was like, no, because she was just told to kind of harden up and just keep going. There's no such thing as mental health. Like, you're crazy. Like, if you have all these, like, if you're feeling anxious and stuff, oh, that means you're going mental. Like, they use these sorts of terms like, oh, that doesn't exist. Like, there is no such thing. Like, just get up and continue doing what you're doing, or you just like to complain. Like, so most of the time it gets like, pushed under a rug, and then they're just told to just keep going. So then gradually it does build up. And then, like, my mum actually gave me an example where they end up just lashing out. So she would just lash out and just be like, and just go crazy. But then after that, she just carried on. And I mean, I guess, I don't know how they did it, to be honest, but the resilience of our parents is just phenomenal. Like, I
mean, there's many gifts they gave us. One of the unknowing ones is probably we can now identify these things, and we don't have to let it build up.
Absolutely.
We don't have to let it lash out. I mean, some of the traumas we carry is because of lashing out.
Yeah.
And I guess I mean physical violence and, all of that stuff. And that is one of the ways people lash out, right?
Exactly.
They try and control what they can control. But if we bring it back to us, and you're not just talking to someone or doing practices to make yourself feel better, you're really preventing these bigger things that we don't want to head towards, right?
Exactly. And I mean, that's the reality, isn't it? There's a lot of the domestic violence and things like that, but it makes you wonder, how are these people actually feeling inside? And is it because it's this buildup of all these things, all these stresses that are inside them, and then that's it. That's the way that they lash out. But we can prevent that, prevent it by speaking up early, getting help early. And by doing that, you wouldn't have to rely on having to do things like, I mean, the other sad thing is recreational drugs, alcohol. People think, oh, it's a quick fix, I'll just go and just get myself drunk and then I feel happy. But yeah, for that moment, yeah, you're happy. But afterwards, the long-term effects and things are just, it's much worse. So it's about preventing it getting to that point, and it's about seeking help early and speaking up and understanding and having that insight within yourself, so that it didn't have to end up in a bad way.
I want to talk about your other job, your social media. Do you think you kind of started this because there's not enough bandwidth in 15 minutes to try and have enough positive impact? So you had to kind of go to online to affect more people. That's just my read on it. But why did you start social media?
Yeah, that's definitely one of the reasons. But also, actually, because like I said before, my happy place is dancing, and my daughter initially was on TikTok, and I just loved dancing with her. So then I just thought, oh, this is amazing. Kept dancing with her, and then she just got sick of me using her page. So she was like, Mum, can you just make your own page? So I was like, okay then. So then that's when I just did my own page, and then my very first video that went viral was of me like sort of saying, people calling me an orderly and a nurse and all these things, but not recognizing that I'm actually a doctor. And that's the reality. Being a Pasifika brown doctor, people don't often think that you're a doctor. They think you're everything else. Anyways, that video went viral, and I was like, okay, this is my opportunity to start making more of these types of videos. Not only one, to encourage youth, because in terms of my upbringing and stuff and being bullied at school and things, I just wanted to show, especially youth, that, anything is possible. We talk about all these factors that can lead to mental health issues, and I've probably been through a lot of them, but I've come out in a good way. I've kind of utilized that in a sense that, okay, well, yes, I've been through all this stuff, but I'm going to be better. I'm going to become someone, and I'm going to share my story to help inspire others who are going through the exact same thing. And so that's what I was thinking. And then also, then I thought, oh my goodness, like I really need to get some of these messaging out there in terms of like health and health promotion. And so I'm going to use this because I can have like a huge reach and just get out to all these people. So I've kind of utilized it in so many different ways. But for some people it might be negative, but for me, like it's kind of been a lot of positive. And I've seen that I've been able to help a lot of our Pasifika people, especially, and that's what I love.
And what do they say when they reach out to you? Like, obviously there's 15 minutes, there's only so many hours in a day, but online they get to have an essence of you in that way. And has there been people reach out to say, this was really useful, or thank you for this information?
All the time. And, like I've had a number of times where I've gone into the mall or the supermarket, and there was this one time, oh God, this gorgeous mother came up to me. And she was like, Dr. Prescott, like these people like talk to me like I know them and stuff. It's so cute. And then so this mother comes up to me, she's like, I just wanted to thank you. And I was like, oh. And she said, because my son was so inspired by your story, he's now in 3rd year medical school. Oh my goodness, and how my heart just broke. And I was like, oh. And then like in another, all these, I get it all the time, and people just come up to me like I know them. Like I've become so approachable that they kind of know me through social media. They think they know me in real life too. So then I meet all these amazing people. And even online, like I get a lot of thank you, like, oh, you've explained that really well. And it's nice to hear this health information from a Pacific doctor, because we feel that we can trust you. We feel that you're a trusted source. Like you telling us this information means that I'm going to go and do that now. Like I'm going to go and seek help. I'm going to do this. And it's just so beautiful to see.
There's a bit of burden here, right? Because I get the sense that when you go on TikTok, it's not like hundreds of views.
Yeah.
And so that might be coming, but that's a problem in itself, right?
Yeah.
That even the first video you talked about, the fact that there's still these stigmas and what's the way to call it? Like, the racism that goes around, and maybe people also don't tie that to suicide. The fact that you have to take the burden of someone else's prejudice.
Yeah.
It leans on you as well. So there's a lot of things to lean on us. And that's one of the challenges about having this podcast. It's like, where do you start? And I guess you start where our communities start, right? You make sure that you find ways to connect and find your identity. And I've seen some of the suicide prevention things are having strong family, strong community. And maybe one of the things to say is for the parents watching that you play a huge part in this too. It's not just a young person problem, is it?
Absolutely.
It's about parents being open and not. Yeah, I mean, have you had parents come in worried about their teens and trying to give them advice about, you can't hard work your way out of some of those things you feel?
Yeah. And I have actually had some parents come in. Not often do I get that, but I have started seeing a lot of parents who are trying, like they're trying to understand what is the meaning of mental health? What is it that I can do potentially for my child? I know my kid is struggling. What is it that I can do to be better? And that's beautiful, like, because I've never seen parents kind of reach out for those sorts of things, But slowly I'm seeing that things are starting to change, and it is. And like you said, it's about working together, and family is huge for us. I mean, for any culture, but for Pasifika people, family is huge. And so unless your family is there to support you, that's the only way you can kind of get out of these things is having that good family support throughout your whole journey.
Is there any bits of encouragement or advice for people who may not go visit their GP, but they're trying to do the best for their families, in terms of if they feel like their younger person in their families, in depression or anxiety? Because, I guess that's the thing, right? To get to you, there has to be some forward thinking.
Yeah.
And we've had a very prevention-based conversation, but at that other tail end, for people in that really high stress, really trying to find the next step to help a loved one, would you be able to offer any kind of advice? I know it's different for everybody.
Yeah.
But because we only have you for a short period of time, over our 15 minutes, I'm really trying to be like, what else can we do? We know there's an epidemic of negative mental health, of suicide specifically in our Pacific community. And it's like, I want to throw everything I can in it. And if it's one little thing that you think might help someone today, I'll ask you.
I think one of the biggest things that I've noticed, and what I think, is it starts within your home. Like, I know that we're all so busy with our lives. We're busy sort of working and we're trying to sort of make ends meet with our young youth and our children. And it starts at an early age, is giving them that attention, trying to listen to them and giving them the opportunity to speak, not shutting them down. So I think most of the time for us people growing up, like, hey, shush, like, just be quiet. But, it's listening to them. How was your day? Showing them that love, showing that you care, and reminding them that I am here. If you want to speak to me, I'm here. Is there anything you want to talk about? How are you feeling? Like, normalize talking about the way that someone's feeling, like even within your household, like, and whether it's to your husband, whether it's to your wife, whether it's to, how was your day? Like, is there anything you want to talk about? Trying to do that with your children at quite an early age is so important because it starts within your home. And I mean, if you need support, there's so much support out there. Like in terms of like, there's websites, there's a free phone line as well, 1737, and there's all these things that we have in place. But I think at the end of the day it starts in your home.
One of the things, Vanisi, is like, we talk about anxiety. Sometimes I think there might be anxiety about going to see your GP, like you've done something wrong. But what would you say to someone who's a bit worried or think they might be getting in trouble for coming to see you? I mean, you're not scary. You're nice.
Yeah, I hope we don't come across as scary. I think that's a really important thing, especially for our Pacific people, is don't be afraid to come and see us GPs. Like, or if you are not comfortable with your own GP, try and find a GP that you do feel comfortable with. And I must admit, the wait time is pretty crazy at the moment. But you want to feel comfortable, know that we are there to help you, and open up. Like if you tell us what it is that you're going through, then we're there to kind of support you. There's things that we can actually provide for you as well to help you get through what you're going through. But don't leave it in, don't bottle it up inside. Come and see us. And trust me, we're not scary, okay? We are definitely there to help you, as well as all your other medical health issues and things, but we look after your mental health as well. So don't be scared.
Awesome. Just want to thank you for saying yes to this podcast. It is, just like in your field, in my field, it's dominated by all the other cultures, all the other topics. And as far as I know, we're the first few podcasts through the gates which specifically talk about our people and our mental health and putting terminologies into ways we will understand. And I love that because if we can better understand it, like you said, better normalize it, then we have a chance at being able to share it in the communities and putting real like terms to things, like I think today we successfully outlined that having a professional to talk to isn't just a box ticking exercise.
Yeah.
It's getting out what's inside. And I think it would be fair to say, it doesn't matter what age you are, that is important.
Absolutely.
And so for you to legitimize us by being a doctor and putting the hard work in is just awesome. Where can people follow you if they want to, I guess, follow your medical stuff, but also the stuff online?
Yeah. Dr.Nisi, Nisi Prescott. You can find me on TikTok, Instagram, and often people reach out to me on social media as well. So, I mean, if you have any concerns or questions or anything, by all means, I mean, we can't give medical advice online, but otherwise, just for support or anything, I'm there.
And just asking for a friend who's got a podcast, if they wanted to make this podcast go viral on TikTok, any advice? I mean, what kind of clip would I have to do?
It's quite difficult, isn't it? And the algorithm and things online is quite difficult. But one of the things that can potentially help is actually like getting in touch with influencers, and then they would then tag you and share it on their platforms. And that's the way that you can kind of
write down, get a great doctor as a guest. Job done.
So if you just tag me and then I'll just reshare the video and there you go. Then it goes.
Thank you so much.
You're welcome.
If you think you or someone you know may be at immediate risk, call 111 or connect to the following services to get help. Text the Need to Talk Helpline on 1737. Call the Depression Helpline on 0800 111 757 or text 4202. If you would like more information on suicide prevention training and education, visit Levar on www.levar.org.nz. www.leva.co.nz. More support numbers are available in the show's description.